Thank you. Just before I go ahead, I am recovering from a cold, so if I do start spluttering out my lungs, just bear with me. I just want to start a bit about my story. I'm a British Asian gay man living with HIV, and I am group rec coordinator at the Terrence Higgins Trust, and I also work to coordinate the counselling services there as well. I was diagnosed with HIV 5 years ago in 2013, and it was at a time which was a really big shock to me. I just went in for a routine checkup, and I was there sitting with the health advisor. I'm at Homerton Clinic, who's been really, really fantastic. And I went for a routine checkup and didn't suspect that I was at risk of HIV. I got all the knowledge around HIV, so I thought I was fine, and walked into the clinic on what was a Wednesday evening, and gay man's clinic, and basically sat down with the health advisor, kind of went through all of my behaviours and what I'm kind of been doing, and because he was a gay man as well, he kind of related to it, so there was no real anticipation of maybe I might be HIV positive. Was an underlying assumption, maybe it could be, but generally I was under the impression that I was HIV negative. I just wanted to have my test done and leave. I come from a cultural background. I was born in Rochdale. I come from a Muslim Asian background where talking about sex, sexuality is a huge taboo. So even going to a sexual health clinic can be quite a big struggle. So I had those ideals in my mind, so even going to a sexual health clinic would always be quite a struggle for me and quite difficult. So I live in Waltham Forest, and obviously Homerton is in Hackney, so it was really, really good because I thought going there, no one would see me, even though people don't really know me in Waltham Forest anyway. But I thought going to a clinic where nobody knows me will be a really good thing, and I'll just be able to kind of hide my responsibilities and my behaviours. So I sat down with a health advisor, and he decided to do a rapid HIV test, which I've had done many times before. I talked to him about, as I said, all my behaviours and what I'd been doing, and said, no risk of HIV. And then we sat down and he took my test and started talking about condom use and all the prevention methods. And then I saw the 2 dots come up on the Insta test, and my world kind of broke down. I've been in a relationship with my partner now for 13 years, and although I knew what I was doing, there was a bit of risk going on, so I'd contracted HIV, and my world just collapsed when those 2 dots came up. I thought, this is it, this is going to be the end of my relationship, I don't know how I'm going to tell my family. As far as I know, my culture and my religion kind of says that what I'm doing is a sin. Being a gay man is a sin, having HIV is kind of the ultimate sin. So when the test did come up, I just kind of shut down. I tried to convince the health advisor that I was going to be fine and everything was going to be okay. He asked me if I had any support, and I just lied to him and said, yes, I'll be fine. But inside I was just kind of screaming and just wanted to get out of the consultation room. And I remember he handed me over some leaflets and some resources, and kind of said a few things for about 45 minutes whilst I was taking the rest of the blood. For my CD4 counts and viral load, and I just don't remember half of the things he said because it was just a big blur. I was just so shocked by that result, and that's one thing that I think when you are diagnosed with HIV, only if you're diagnosed with it you can feel that, you know what that emotion's like, when you just kind of get that feeling of relief and also worry and anxiety about what this means for the future. I was well educated as a gay man about HIV and what it means, and at the time, about 5 years ago, we didn't have all of the idea around treatment as prevention and what it means today, but there was an idea that you could live a long, healthy life. But I was still worried because of my cultural and religious background. I thought, this is going to be the end of it, this is me sinning, I'm going to go to hell, this is what I've been destined for. How am I going to tell my partner? How am I going to tell my family? How am I going to share this with anyone? So I'd convinced the health advisor that I was going to be fine, and walked out of the consultation room, told him I've got all the support, I'll be fine. And I was heading home, and my partner was cooking dinner for me, and I had the choice of either sharing with him what had happened or kind of bury my head in the sand. And I chose the latter. I decided not to share that with him. I decided not to actually share it with anyone. I basically for 2 years didn't share my status with anyone, even my partner. Our sexual relationship kind of had gone down the pan as well. I'd kind of always make excuses around work, around my life, just any old excuse to kind of just say, yeah, I don't want to do this, and not talk about it. I'd kind of isolated myself. And it was kind of really, really hard because it took me to a really, really dark place. And I was really, really good at hiding it. I think something in my culture, because we don't talk about these things, it's easier to hide and not share it with anyone. So over time, I started getting worse and worse, but one thing I did know because of the education around HIV is that I wanted to keep continuing engaging with my clinic. At Homerton, my doctor and the care there that was provided were really supportive. They recognised that there was things that weren't adding up, so every time I'd go in, I'd just pretend to be really sheepish and really go, yeah, I'm fine, everything's going to be okay. My doctor had recognised that I was slowly just being more and more quiet about what actually about the process, and did suggest to me to take counselling up with the team in Homerton, which at first I was quite reluctant to take up, but I did. And after a while of counselling, my main aim for counselling was to basically start discussing with my partner about my status. And every time I just have so much anxiety about going to that counselling session, because again, in my culture, you don't really talk about your feelings, you don't really go to a counsellor, you don't really go to a therapist. In my religion, we have God, and we talk to God about these kind of issues. And in my religion, Islam, and God basically was telling me that being homosexual was bad enough, so having HIV, I was going to be punished, and this was my destiny. So I didn't really need to share it with a counsellor. But I did go to counselling, and I did go to therapy, and over time it kind of broke and chip away at me, and I realised that, and I was getting worse and worse. I was actually in a bit of a dead-end job, and it was at a point where I started contemplating suicide, and I mentioned this to my counsellor, and I said, enough is enough, I need to kind of share this with somebody before something bad happens. And it was a really big struggle because in my religion, again, suicide is forbidden, so I knew that if I did that, I'd probably be ultimately doing the biggest sin of all the sins I've done so far. So I thought, I'm going to make a change in my life, and I'm going to start by telling him. So I shared my status with my partner. After many days of setting a date, setting a time, and that was it. I was worried. I was like, this is it. He's going to chuck me out of the house. This is my life's over. I'm not going to be able to live healthily ever again. I'm just going to be struggling for the rest of my life, but this is my destiny. I'm just going to have to accept it. So I told him. We wept and we cried, and it was quite a surprise because his reaction was actually something I didn't expect. It was actually quite anticlimactic. I said to him that, if you want me to leave, I will. And he said to me that we are better together, stronger together than we are miserable apart. And I'm sad that you didn't feel that you couldn't share this with me, and I'm glad that you are now, and I'm going to help you and support you no matter what, because I love you. And and that just kind of changed my perception, and I thought, if he can forgive me, then perhaps God will be a little bit more understanding towards my needs, because I've punished myself enough. So I started making positive life changes. I started reaching out more to HIV charities for support, and started volunteering. Then I was lucky enough to get a job with the Terrence Higgins Trust, and now I coordinate the group work there and the therapy with Terrence Higgins, and working predominantly with newly diagnosed people living with HIV. And those long-term living with HIV. And it's just amazing to be able to empower and inspire people and be able to share my story with them, learn from their experiences, to be able to kind of offer better support. So one of the reasons I wanted to share a bit about my story was to highlight the fact that everyone's HIV journey is unique. And although I faced many barriers as health professionals, I think we need to recognise that individuals have struggles that we cannot always relate to. Social, cultural, religious factors that mean accessing support, including getting to a sexual health clinic, might be an initial struggle. This is not to say that people will reject the support that we offer, but we must try to understand the behaviours they display and see how best we can support them. As a gay man, with the education around HIV, I knew very well what I was dealing with, but my internal battles allowed me to not always accept my diagnosis and reject any help that was offered. We need to recognise that every case is individual and everyone has their own battles and journeys to follow. We cannot treat every situation with the same overarching health care and support that we provide. I just want to share that it's important that we adopt a more nuanced approach. As healthcare professionals working at the Terrence Higgins Trust as a group work coordinator and engaging with my clinic, I've realised that we need to recognise that this inherent diversity within ethnic communities and a client-centred approach, making a concerted effort to understand the needs of the clients in order to build trust and reduce these barriers. Often minority and BAME groups are labelled as hard to reach. I would like us to consider, what does that really mean? Are they hard to reach, or are we using the wrong tools of engagement and communication? Are our health promotion messages fully understood by the target audience? I'm a gay Asian man. This comes with many assertions and assumptions. What I found helpful is when I feel like I'm not being judged by preconceptions and I'm allowed to voice my needs and I'm allowed to define myself rather than be told who I am and what I may need based on healthcare data and research, and a social narrative of what it is to be gay, Asian, HIV, positive, and a man. However, that doesn't define me. I'm also a son, a brother, an uncle, a partner, a friend, a fashion designer, an activist, an advocate. I speak 2 languages, and I like doing marathons. But how would you know these things about me? I feel that the main focus of my identity is restricted to me being gay, Asian, HIV positive. I feel like sometimes when I go into a clinic, it's all about, or into a community setting, or to a charity, it's all about ticking the boxes. As long as I've ticked the box which says British, Asian, Pakistani, I fit a demographic and I fit a narrative that they want. And this comes with many assertions and assumptions. What I found helpful, I'm a gay Asian man, and this comes in many assertions and assumptions. What I found helpful is when I feel like I'm not being judged by preconceptions and I'm allowed to voice my needs and I'm allowed to define myself rather than be told who I am and what I may need based on healthcare data and research, and a social narrative of what it's like to be a HIV positive man. However, that doesn't define me. I'm going over the same bit again. A holistic approach is always more favourable than pathologising people we are trying to support. We need to work within multidisciplinary teams involving partners far beyond the sexual health sector. A collaborative, inclusive approach whereby those we seek to support are included in the design, delivery and evaluation of the service we wish to provide. This includes engaging with community organisations, businesses, corporations and the media. We know spending on sexual health has decreased over the years, and this is having a negative impact on not just general population but also BAME communities. Numbers of the diagnosed in the BAME community are probably much higher than those that are recorded. Whilst combination prevention is clearly seen as effective, there has been a slow uptake of the life-saving and life-extending treatment in BAME communities. We need to have a more inclusive strategy that addresses the specific needs of BAME communities in order to maximise take-up. I want to also just quickly mention about from a South Asian perspective, because I sometimes think that in the BAME community we all just kind of get boxed in under BAME, and that's a very broad spectrum. As a South Asian man, I don't always just identify as being part of a BAME community, because in my community, if I go into my community, I don't always fit in. I feel like I'm just a little bit of an outsider. They see me as too Western, they see me as too gay, they see me as somebody who's not in tune with the Asian society. So I think it's really, really good that we open up spaces for South Asian men, like the Show Love project, which was done by the NAS project, which I was a part of promoting. It's great for peer support and allowing people to voice their opinions, but as healthcare professionals, we don't always understand and kind of get ourselves involved in what their needs are. We create spaces for them to have those conversations, but we don't really always learn from it to understand what their needs are and what their struggles and strifes are. South Asian gay men specifically are less likely to engage with sexual health services than other ethnic minority groups in the general population. There's much work to be done to make the Asian community understand gay culture and awareness around engaging with risky sexual behaviour, and so they are less likely to seek support and be diagnosed. South Asians have the least knowledge around HIV of all BAME groups. The lack of knowledge in turn means people from the Asian community are unaware of the risks and unable to access prevention. So I'd like us to just think about how we would just kind of open those narratives with anyone that comes in through the door to see us that maybe identifies from that group, and not just kind of giving them the same overarching support that we give everybody else, and not just making assumptions because of the way that they are or the way they look, and when they walk in through the door, giving them the respect and the openness to understand who they are and how best we can support them. Yeah, thank you.